Hello everyone, how's it going? Did you know that vascular dementia is the second most common cause of dementia in people over the age of 65? Have you ever wondered what causes it and if you could be at risk? Well, if that sounds interesting to you, then keep watching. So what causes vascular dementia is actually a lack of blood flow to the brain. There are conditions that can cause blood flow to be decreased or interrupted, the most common one being a stroke. Now, if someone has a stroke and it blocks an artery, it actually can lead to vascular dementia. However, not everyone who has a stroke is going to wind up with vascular dementia. Some people actually develop a brain hemorrhage, which is often caused by high blood pressure. And there are some people who have conditions that chronically cause damage to the brain blood vessels. It actually even causes a narrowing sometimes of those blood vessels that could lead to vascular dementia. It tends to happen more with men than with women. Now, as far as the symptoms, it depends on the size, location, and the number of damaged areas of the brain. But vascular dementia usually affects judgment, reasoning, and complex problem solving first, which is different from Alzheimer's. Alzheimer's generally begins with an erosion of memory and difficulty with word finding. Now, some of the symptoms may be confusion, trouble paying attention and concentrating, reduced ability to organize thoughts or actions, trouble analyzing a situation and coming up with a plan and being able to communicate it to others. You may start having slowed thinking, difficulty with organization, difficulty with what to do next. Eventually, you may start having problems with memory. However, it may not affect the short-term memory. Some other symptoms may be restlessness, agitation, changes in stride, depression, apathy, and even urinary incontinence. Now, before we move on to who are most at risk for vascular dementia and how it's diagnosed and treated, I'd like to remind you to please like and subscribe. I'd also like to remind you to make sure you open up the description box completely. Make sure you tap on the show more because you may find some of the links below helpful for more information. Now, as far as the risks, one risk would be age. It's very rare to be diagnosed with vascular dementia if you're under age 65. So as you get older, your risk increases. If you have a history of heart attack, strokes, even mini strokes. If you have a condition called atherosclerosis, that could put you at greater risk. If you have high cholesterol or high blood pressure, you're at greater risk. If you have diabetes, definitely you're at greater risk. One study even suggested you may have 60% more of a chance of getting vascular dementia if you have type 2 diabetes compared to those who do not have that condition. If you're a smoker, or if you're overweight, or you have atrial fibrillation, which is actually an abnormal heart rhythm, those all put you at greater risk for vascular dementia. Now, in order for the doctor to diagnose vascular dementia, they would talk to the patient about their medical history, lifestyle. They would probably even want to speak to a friend or relative that knows the patient well. Most likely they would like to do a neuropsychiatric evaluation to rule out a psychiatric condition, and then a neuropsychological assessment, and that can help them to determine what type of dementia a person has. Now, vascular dementia often occurs in combination with Alzheimer's or other dementias. This is actually called mixed dementia, when there's more than one type of dementia that occurs simultaneously. Of course, the doctor most likely will order brain imaging, so a CT, an MRI, EEG, and perhaps a PET scan. Now, the treatment for vascular dementia is actually to prevent further damage to the brain. So the doctor may prescribe medications to manage blood pressure, cholesterol, triglycerides, diabetes, problems with blood clotting, things like that. Medications can help with. The doctor is also going to recommend a heart-healthy diet, exercise. If you smoke, he'll encourage you to quit smoking, also encourage you to quit or decrease alcohol consumption. There are some procedures that can be done too that can improve blood flow, such as angioplasty and stenting. Now, there are also medications that can treat some of the symptoms of vascular dementia, which sometimes it does include depression. Now, it's not always easy to diagnose. In order to get a diagnosis, the decline must be in two types of thinking skills, in memory and language. Now, if the decline isn't severe enough to impact daily life or daily function, it's called vascular cognitive impairment. Now, vascular dementia can be easy to determine if someone has like a large stroke and their symptoms come on suddenly. But there are some people who have very small, like mini strokes, and so they have very mild symptoms. So they may go through periods of decline, and then all of a sudden they seem stable, but then they start to decline again. And sometimes people will just ignore the symptoms, thinking that it's just because they're experiencing a lot of stress. But if you're concerned about yourself or a loved one, you definitely want to schedule an appointment with your doctor. These health assessments or health screenings are so important, especially if you have any history of a heart attack or a stroke, because you definitely want to get treatment as soon as possible to prevent any further damage to the brain. Better yet would be preventing many of these health conditions that could lead to vascular dementia. Of course, it's easier said than done to adopt a healthy lifestyle, but maybe you could set it as a goal to try to at least just change one thing in your life to improve your health. Just take baby steps and you'll get there little by little. Well, I hope you've enjoyed the information in today's video, and I hope to see you in the next video where we'll discuss another way we can improve our health.